Officials from health centers used to ask for drugs from National Medical Stores, NMS, in line with the Ministry of Health policy. But this changed. Now health centers 3s and 2s wait for the drugs to be delivered to them.
NMS sort of like found it difficult to deal with that situation because they reported that they're not getting orders.
Martin Oteba from the Pharmacy Department in the Ministry of Health says this change was made after health centers complained of constant drug shortages, yet their orders were inconsistent. Previously, health centers got drugs from NMS after making requests, a system referred to in health ministry circles as pulling drugs. But it has now changed to getting the drugs without making requests, known as pushing the drugs.
The NMS circle is 2 months.
With this comes way too many drugs, more than the health workers at Alero Health Center 3 in Nwoya district need.
We don't need them at all.
While they appreciate the fact that they're getting most of the medicines that they need, they're disturbed by the fact that they're brought in rather larger quantities. And what is the result? This. Boxes of medicines that are getting expired. All this is wastage. Medicines that could be used in other health centers. What is the expiry date? May 2013 is the expiry date for this, and they're still here.
Around 3 bottles that are expired, and each has 1,000 tablets. So, like in a month, we have few, mostly we give to asthmatic.
We collect all those expired drugs and bring them to one central point in the district health office store, where we expect National Medical Store to come and pick it and take to a central point in Nakasongola for destruction.
It is not our mandate to pick expired drugs. The health facility is supposed to liaise with the district. These drugs are returned to the district store, and then they liaise with the Ministry of Health and see how to insulate.
One time we wrote to National Medical Store, stopping them from supplying us coartem. But they went ahead to continue pushing to the lower facility. Not until we raised the issue again is when they really stopped the supply. But the coartem that they were forwarding was having a shorter shelf-life.
We need to verify that, but the standing position is that the NMS should be, once notified by the facility or by the DHO, is supposed to retrieve those things back to the center for safe custody and also disposal.
We don't dream about what to buy. Every year we buy according to the procurement plans. And for any medicine to enter our stores, it must have 75% shelf life. That means it ranges to 2.5 to 3 years. And then at the last health facility, they tell us they're about to expire. Where did they get them from?
The district drug inspection officer says that as a district, they have strategies for redistribution, especially drugs with a short lifespan.
First priority goes to facilities within the district, then other nearby facilities like Gulu Hospital and 4th Division Military Hospital to avoid just this kind of losses.
When they push to other people, they give them those which are going to expire.
You remember NMS is serving every 2 months. And for you are keeping a medicine for 2 years. Ultimately, you'll have to lose the medicine. The best way is, if there was proper supervision, there would be a constant exchange, constant redistribution within a district.
In spite of all the shortcomings of the drug push service, the main explanation from the Ministry of Health is that the staff shortage plays a big role, particularly in districts like Nwoya.
You've just told me about a midwife getting away from a delivery room to help in the clinical right. You can see that is a challenge. The uptake of supplies is much dependent, not necessarily only on the rights, but actually on the presence of the human resources that can have the right level of prescribing these medications.
District health officers are, however, tasked to take care of monitoring the usage of the medicines.
Within the jurisdictions of the district, transfer these supplies from where there is a low uptake to where there is a relatively higher uptake. Some districts are doing it perfectly well, others are not doing very well.
He, however, says that oft times the politicians and technocrats clash.
Look at movement of products from one facility to the other as actually grabbing from that facility.
He adds that the district has surprisingly been asking for more drugs.
Now you are revealing, it's a revelation, that the same places again have excesses, which is a bit of a problem to us.
Actually, the medicine that gets down, especially to the lower health center 2 and 3, are not actually adequate. And sometimes the quantification which are made do not conform with the kind of diseases that we may have in the community.
Whatever we send them is based on 1, their procurement plan, 2, their orders. If, for example, in anyone's procurement plan, they put that they will need 1,000 tins of Panadol, and in their subsequent orders, they don't order Panadol for like 3 or 2 times, or for the whole year, and the year is coming to an end. As national medical stores, we shall push them 80% of that medicine. That's how it comes about overstocking. That's how it comes about out of stock. That's how it comes about us pushing them some of the medicines even when they have not appeared in their recent orders. And where do you put them if you are the one?
Then you find other health centers which might...
Where? Because each health center, I've told you, each district has a procurement plan.
Sometimes, however, it is other supplies other than drugs that are in excess.
Patients, they don't want you to tell them this one is not there.
You do not burden us with your poor planning, or you even do not fetch in someone else's budget who had planned rightly.
But for the excess unwanted drugs in Alero, many people rush to the health center to take all they can. They still can take home.
They come and pretend. For you, you will be seeing them knowing they have cough, what. Because we realized late, there were 2-3 cases of that drug abuse by children to asthma.
It's also expired. The fact that many drugs are going to waste in this health center and in others can't be ignored.
I foresee not far in the future, or maybe, who knows, in 2-3 years' time, a scenario where now we go back to more facilities being able to make their orders independently.
At the moment, only hospitals and health center 4s, with the exception of a few health center 3s, are involved in pulling their own drugs from national medical stores.
November 2012.
Yeah.
And they're still here.
Yes, and we know them, we don't use them.
The greatest fear in all this is that patients may unknowingly end up getting expired drugs because some are given by non-qualified staff. This poses a great threat to an already needy health sector. Florence Naluyimba, NTV.